and depending upon the status of ApoE gene, that will determine whether or not a particular a body weight control drug will be effective or not. So those are quickly. There are many examples. In fact, now online, the LinkedIn, and there are a number of discussion groups. In fact, I'm leading one of them called the Individualized Molecular Testing for Personalized Medicine. We are actually being sort of ranking the top 10 most popular biomarkers, and that can be used in this purpose.
Have you received any feedback about this ranking? I'm just curious.
Yes. In fact, we currently have quite active discussion, and I think it became clear now. Really, KRAS mutational analysis, and this is also including BRAF, is probably the top one most popular biomarker for the treatment of lung cancer, and also non-small lung cancer and colon cancer.
I would be very curious, and actually I'd like to invite the discussion to move over here online, because when you have enough votes, maybe you can invite people and we can discuss that, but this is quite interesting.
Yeah, I'm hoping some of my colleagues online are actually watching this, and if they want to call in to express their opinion or disagree what I said, I think that'd be great.
Thank you. Just want to point out that if people are watching, they can actually call 724-444-7444, and then they have to dial the number 113311, which will place them right into this particular broadcast. If you are watching a video on YouTube after this recording is done, you can just email at the following email, and some people will pick up your emails and they will be forwarded to Dr. Richard Zhao or myself. The email is producers@personalizedmedicinetv.com. Once again, producers@personalizedmedicinetv.com. And of course, all of the videos and episodes are uploaded on YouTube, and you just have to search for Personalized RX TV. So I'd like to move now with another question. You mentioned that pharmacogenomics tests are to assist physicians to decide on the correct dose of a particular drug. Can you give us an example about that?
Yes, actually, there are actually quite just like theragnostics, and there are actually already a couple of related individualized molecular testing we could do. And I can give you quickly three quick examples. One is called the CYP2C6 and CYP2C19, or overall in general called CYP450 assay, and that actually can help as a psychiatrist to treat patients with depression. And this is quite interesting to me. Because we all know depression is a rather difficult condition to treat, and not every drug will fit every patient. I think this is a kind of a headache to psychiatrists, and in particular, some of the patients who being hospitalized. I was told by my colleague that the average hospital stay is about 2 to 3 weeks. So during that time, a psychiatrist will try out different drugs, and hopefully one of them going to work. And now with this kind of individualized molecular testing, with the CYP450 test, and now we can quickly offer this test, and hopefully they can pick the right dosing out of a particular drug. And I was told the anticipation is the psychiatrist can actually probably reduce the hospital stay at least by 1 week. So that's significant. And two examples. This is what I personally involved at the University of Maryland School of Medicine and Medical Center. And one is a drug called warfarin and Coumadin. And this drug is actually one of the most commonly prescribed drug in the world, and there are about 8.8 million prescriptions a year. It's a very effective drug in terms of treating a patient with stroke, heart attack, basically the blood clot. It's a blood thinner drug. And however, now the challenge is if you have a patient in ER, you come in, you treat the patient. If the dose is too high, there are a certain percent of the patient. I believe the statistics say it's about 1.2 up to 7% of those patients going to develop bleeding, and some of the bleeding could have a very actually have a fatal consequence. So the dilemma now is what kind of dose you could possibly use, high dose, low dose, and so with the current medicine, really there is no clear indication. And with individualized molecular testing, now there is a test called a CYP2C9 and a VQRC1. And with these two SNPs analysis, and now we are able to advise physician to tell the physician, say, yes, this patient can using a relative high dose, or probably no, you better watch out. And if you're using high dose, and this patient might develop bleeding. And of course, at this stage, and it's still in a relative early nationwide clinical trial called a COAC trial. In fact, University of Maryland is one of the 12 medical centers in the country to carry out this trial. And the second one is called PAP-P2 trial. It's basically dealing with another drug called Plavix and Lapidogrel. Which is an antiplatelet agent. Is actually, in a way, my understanding is similar to warfarin. Is also blood thinner, and to treat a stroke, for example. And it's very the pharmacological feature are very similar to warfarin. It's a difficult drug to prescribe in terms of dosing. And now we have another test called the CYP2C19. And with this test, once again, we can, similar to warfarin, the test I just described. And now we are hoping, and there is also a nationwide clinical trial, as I said, PAP-P2, led by one of my colleagues, Dr. Alan Schodener. This is a nationwide clinical trial. There are 5 national centers in the country. In fact, I'm leading the laboratory for this trial. And the hope is by end of the trial, we can develop a general consensus to exactly using the right dosing for Plavix, Lapidogrel, or warfarin covalent, as I just described.
Thank you. I'd like to move on and ask you, you also mentioned another term, and this is the prognomics. I'm not sure what kind of tests can be associated with this term, if you can just explain a little bit more about it.
Yes. Prognomics, as I mentioned, is basically we use a particular molecular-based testing. We are measuring a molecular profile of a gene or multiple genes, sometimes we call it gene array, and this will, along with bioinformatic information we learn about those particular genes, and also along with the statistical analysis, statistical model, to using this particular tool to predict the outcome or prognosis of a particular disease or condition. In fact, I can give you maybe 2 examples in this particular case. One is there is a test called and it's basically a gene array-based testing. It's like a 20 gene, I believe. And what it does is, by looking at, this is for a heart transplantation patient. And this test result is used for to or not a patient who received a transplanted heart called a xenograft can Are we okay here?
Yeah, we had a little bit of a delay. We had a little bit of a delay, but it's fine. So, it does happen with the internet. No problem at all.
Okay. So